Maternal mortality in Nigeria is high. In fact, Nigeria is said to be contributing 30% of global maternal deaths, despite being just 2% of the world population. It's even ranked as number one, and which makes people say it's the worst place to deliver. And in line with the president's vision, he said it's one position that we must lose. We can't afford to be number one. And in line with that vision, MAMII was launched and then inaugurated to ensure that we have a country strategy to really change this narrative of crashing maternal mortality in our dear country. We can't afford, in line with the president's vision, to needlessly lose the women. This is a great platform that will ensure that many of the success stories that will be recorded in MAMII, particularly, as we begin to impact lives, will be amplified, will be showcased, in fact, such that we can help renew the confidence of the women, in our health system. In time past, there's a total loss of confidence in the system. Women no longer want to come to the facility, to deliver. So with this Renew program, we can begin to showcase the success stories of women, giving the narratives of how their lives have been touched with the MAMII program. And this will help, improve one of the critical objectives of MAMII, which is to increase facility utilization. If the women actually come to the hospital, we are pretty sure that they will definitely be attended to by a skilled birth attendant, which we know will definitely be safe. We make the pregnancy safe, and we can have a clear, safe delivery. So this, to us, is a very important platform that we need to leverage on or latch on to ensure that we project the good work that MAMII, will be doing in line with the vision of Mr. President. So first and foremost, the MAMII strategy basically first, in line with the minister, coordinating minister's directive, Muhammad Ali Pate, to say, let's understand where these women are dying. And we identify 172 LGAs, across 33 states, in the country, looking at 2.9 million women, And this LGA contributes 55% of the total maternal mortality in our dear country. So if we're able to address, maternal death and neonatal death here, we're pretty sure we'll be crashing our maternal mortality by 55%, already. So that's actually informed our focus, on this. Secondly, is that we also need to understand clear context-specific why the women are dying, because it varies across the region, even state to state. We've seen a lot of variation in terms of the barriers, the drivers of maternal death. And so for us, having clearly, understood issues around the 5 delays. I know most people know about the 3 delay or 4 delays, but we are seeing there's a delay in women seeking healthcare, there's a delay in women reaching healthcare, there's a delay in them receiving healthcare, and there's also the delay, in taking responsibility of the referral to the next level of care. But one critical delay is that responsibility the coordination of all the various interventions. Time passed, which is the reason why our maternal mortality in our country has not made much significant progress, is the fact that we had always had a silo approach and intervention. So now MAMII is looking at a coordination which brings all stakeholders, on board, which is the sector-wide approach. We're using that sector-wide approach lens, to really look at crashing maternal mortality, meaning if we are trying to intervene in improving the health-seeking behavior of the women, we also need to put in place emergency transportation. We also need to ensure the facilities that we are sending them to are ready, and then ensure that for every unfortunate maternal death, we are able to, track them. And then, of course, the issue around the financial access, the protection so that they don't run into a catastrophic spending. So this, all of this, and then providing an enabling environment for proper communication, enabling environment for improving the digitalization of all of these processes, so we can also have a clear platform to connect, the women from their communities straight to the facility with the ambulance, and then ensuring that they are insured. subsequently, so that they can take good care of their children under 5. So for us, all of this is what MAMII bring on board, and then establishing at each level, from community, the World Development Committee, straight to the local government, the State MAMII Task Force or State MAMII Steering Committee, all to the MAMII National Coordinating Committee. All of these do ensure proper coordination. And this way, we are beginning to see the trajectory is changing. So first and foremost is the fact that we are not sitting in Abuja trying to create solutions for people at the state or at the community level. So we try, move from Abuja here with the team. Like I said, it's a sector-wide approach. Team from the National Primary Health Care, from the National Health Insurance, National Emergency Medical Services, Federal Ministry of Health, SWAP Office, will lead, to each of these states. And I must tell you now, we've been to 21 states, out of the 33 states, and of course, this has, we've been able to clearly understand, what are the issues across, these different states. And I can tell you for free, there are different drivers of maternal mortality. So with this approach, we've joined the state team, the State Ministry of Health, State Emergency, State Insurance, and then the State Healthcare Board. So all of this we meet together and then go to the community to meet the community. So with this kind of approach, it becomes a bottom-up approach. You are not trying to send it down from Abuja. We co-create with the community, we sit down and have a clear implementation plan to crash maternal mortality. There is state ownership, there's community ownership, and then what this federal only do is to provide that support, to the state for them to drive the process. So this, for me, is something that is super different from all we've been doing in time past, which has informed, a great kind of ownership, because whatever we now do is then input into the annual operation plan for the state, which government then have to fund. Perhaps there are gaps, in it. That is where the swap comes in to say, okay, you know what, I can then mobilize resources through the partner, through the federal, and then ensure, that we are able to successfully, seamlessly implement, all of this plan to crash maternal mortality, as we have developed now 21 plan across the 21 states. So it is early to say we started having clear impact, but what is clear is that first, women are now being transported, free of charge, courtesy Mr. President. And secondly, there's a financial protection. Now we are having increase in number of women having free cesarean section. And of course, with the process of tracking of first, there is a line listing. For over 500,000 women have been line listed, meaning they are known by their phone number, address is known. There's a tracking in process, so with all of this, we know clearly, we are on the path. So since we are able to move them, through the facility to deliver, which is called the obstetric transition, from stage 1 to stage 2, definitely this will ensure 50% crash in maternal mortality. So with this, we are very sure by next year, we'll be doing our first mini DHS in line with the coordinating minister's vision, that we do not wait, till the 5 years of the NDHS, we have to do it midway. And so we'll be doing that next year. We clearly know that we will definitely be having a reduction in maternal and newborn mortality, in our dear country. Met a woman at Kwara State, Ilorin. She told us the story. In fact, she was one of those that gave this testimony during the MAMII service provision activation. And she told us how their house got razed and all property lost, in the process. As a matter of fact, the only son was lost, in the funnel. The husband got half burnt. And then she was pregnant, heavily pregnant. She now, fell into labor, had to put to bed. And on getting to the facility, she was told she requires cesarean section. It was so pathetic that she said she had to run out of the place because she knew end has come. But what was so exciting was the doctor running after the woman to say, madam, come back. We have not concluded our conversation because I know that here, is one of the facilities empaneled by the National Health Insurance to provide free cesarean section. And the woman couldn't believe until she went through the cesarean section, had the baby alive. So she came to the service activation to say, what, this is what only thing that I have. And that really in itself means, the far-reaching impact of MAMII. So she doesn't have to go through the catastrophic spending of looking for money because they've lost everything. Now, so she now has a surviving child and she herself is surviving. Now they're not looking at how to take care of the husband who's just recuperating at the facility. So when you look at cases like this, shows how much impact, this program MAMII is bringing, to across, the various nook and cranny, of the country. And I tell you, for every individual involved in this, the transportation is 10,000 per every transportation. And you imagine a keke driver that's helped transport a woman and has been given a 10,000 for every transportation. So it goes a long way to impact, improve socioeconomic life. And of course we are also coming with a partnership, with the traditional birth attendants to also continue to incentivize every referral to save lives. So for us, we are also on the right path, and we believe, by the special grace of God, we're changing narratives, and Nigeria will become a safe place to deliver. So definitely, like I mentioned, if we are able to project this, the impact of the programs, across the nook and cranny, we definitely, will renew the confidence. In fact, another aspect of MAMII is the integration of the sexual reproductive health, into MAMII. We have about 8 states which this is ongoing at the moment. And we are looking at post-abortion care. We are looking at family planning. We are looking at the adolescent, health. So we know that part of what Renew How we do is also to renew the sexual reproductive life, so they can help reach a lot of adolescents that are on the social media platform, who we need to talk to about their menstrual hygiene, about even getting ready, for menstruation. Menstruation happens by accident, we know that. And so also is when the women are also going to end it, it may likely also happen by accident. Proper education, sexual education, health information, this is what we're going to work together to be able to sell across, to the youth, to our adolescents, to ensure that they are ready, for their puberty life. And so we'll look forward to this great platform to help us be able to achieve this desired goal. One of the critical objectives of MAMII is to crash maternal mortality, but how do we achieve that? We need to get the women to get to the facility. So as we begin to project and share experience of success story, free cesarean section, free transportation, the women can leverage and then seize the opportunity to uptake all of these services. And then that way, we know that we can increase facility utilization, which we hope to do for up to 60%, which definitely we know will bring the women to the skilled attendant at the facility, and then we help crash maternal mortality. So that is what we're looking up to, for, MAMII, to continue to get the information out there. And of course, again, one critical thing is the fact that the world also needs to know that currently the current president is passionate about this, and we need to get the information right out there about the country's efforts to crash maternal mortality and change the narratives. So this again has to get to the right quarters, and they need to also know that we are not sleeping. We are ready to lose this #1 position, or we're ranking the first in terms of the highest maternal mortality. The president is committed to it, and we are also determined to make sure that we lose this position. It's one position that we need to lose, to make our pregnancies safe, and by choice, and also make all the children to live beyond the age of 5.